Hello, namaste, everybody. This is Namaste Radio. We are live here on Facebook today. This is the Wednesday of Thanksgiving week. I hope everybody has had a great start to their Thanksgiving week. It's been a good one so far. It's going to be even better now because we are live here on Facebook with the one and only Mr. Laquentin Jenkins of Simple Choice Insurance Brokerage. We had him on in studio just a few weeks back, so if you missed that, uh, where were you? Second of all, if you want to go back and see that video, you can go to our Namaste Radio's Facebook page or our YouTube channel and check out that video as well. Hello, Mr. Jenkins. How are you? Let me see, can you-
It is an amazing day. It's a great day to have a great day.
Awesome, awesome. I'm also joined by up सबकी favorite Vanchika. Hello, Vanchika. How are you?
Hello, namaste everyone. How is everyone doing? I
Doing
am
great.
good.
Awesome, awesome. So yes, we are live here on our Namaste Radio's Facebook Live, and great start to the Thanksgiving week. How's y'all's week been? And you guys looking forward to Thanksgiving? A lot of food tomorrow. So,
I'm looking
Yeah,
forward to taking a
absolutely.
nap.
you look
I'm looking forward to taking a nap.
already. You haven't even eaten Thanksgiving dinner yet. You're already ready for.
Man, it's been busy, but great busy. It's been great
Mhm.
busy. Just having I think I have too much fun at what I do. That's what I'm concerned about. Am I supposed to have this much fun? Well, I enjoy people.
Oh, it's never
I mean,
know.
I love meeting people, different backgrounds, and just hearing their stories and laughing and eating. So
Yeah,
it's been a great
who
week.
doesn't like eating? So,
Absolutely. And that's the best thing when you are having fun when and you're working. So thank you for I'm glad you are, because when you do that, and thank you for that, because when you are having fun, the people that you help also have fun. It
Absolutely.
could be with all the information that you bring to them. It could be with all the money that you help them save. So thank you.
Yeah, yesterday I was in the Sugarland area working with a business owner,
mm,
and we were able to save him $31,000 a year.
wow.
$31,000 a
Wow.
year in his
Mm,
benefits for his himself and his employees. Needs to say
mm.
he bought lunch.
He bought. I would assume he should would,
Needs
right?
to say he bought lunch.
Yeah,
He gave me a big hug, and then he say vacation, vacation, vacation.
that's true.
He
Yeah.
said now we go. It's a nice vacation. So that was pretty
Awesome.
cool. It was pretty cool.
Absolutely, that's amazing, amazing. So let's get started with the important information that you have for all of us. Firstly, again, thank you, Mr. Laquinton, for supporting Namaste Radio. Thank you for partnering with Namaste Radio and bringing that information. And like I always
Thank you.
say, health insurance is one of the most important topics in our lives, and you bring so much valuable information on that. So we are 3 weeks away into the enrollment season. What kind of trends are you seeing with the plans that are being selected?
Well, one thing for sure is that last year many people chose plans. I'm gonna do my best. Not to name specific plan names, but I may slip up here and there. But last year, I'm hoping people can learn from the lessons from last year. Last year, there was a plan that came new into the market, and they dropped their prices really, really low, lower than everybody else, and
Mm,
people were buying it like crazy. And as expected, it was a horrible experience. Customer service wasn't good, and the overall doctor selection, hospital selection wasn't good. And now this year, that those plans are the highest plans in the marketplace. So what it does is now it creates stress on a lot of the clients because now they got to go find a new plan, new doctors, new hospitals, have to do everything all over again. We don't want that. There are some plans that have came into the marketplace that are new to the market that they are, the lowest in the market. But the thing that I've learned is that the sustainability of those, they're buying market share. Not saying it's a situation right now, but I see it often where you want to look for plans that are more stable. So one thing I can say, particularly in the Katy, Sugarland, Missouri, Richmond area, one thing I can say is that the consumers are getting a little wiser. They don't want the cheapest, they don't want the most expensive. They've learned that somewhere in the middle right? Somewhere in the middle is probably what it need to be, because what it does, there it's allowing them to build history with the same physicians, knowing they have access to credible coverage, so that wherever they go, they're able to get the best of care. So I am seeing a smarter consumer. I am seeing a consumer though is still needs to be conscious of what the basics of copays, deductibles, co-insurance, and max out of pocket is, and that is can be a little confusing. It can be a little confusing, but there are a couple of plans that I really see that many of the consumers are gravitating to, particularly in the Southwest, because in the Sugar Land, Missouri City area, Memorial City, Methodist, there were big hospitals for them in those areas. So the reality is there is only one plan in the marketplace that includes Memorial and it includes Methodist. There's only one plan in the
Oh,
marketplace that does that. So if again, I don't want to, say too much about plans names on the air, but if you reach out to us, we have the conversation, I can share with you those plans and make sure that you have access to the physicians in the Sugarland area. Sugarland seems to be a little bit more educated area when it comes to healthcare. Their buyers are much more aware of what they want. So we just take that and we help them look at the details of the plan and kind of figure out the best. But in the Sugarland area, there is only one carrier that includes Methodist and Memorial in their network. So that's kind of where we're headed. We're trying to guide our clients to those so they can be happier. Try to get it so they can stay with the same plan from year to year versus having to jump from plan to plan year after year. So that's kind of what we've seen as a more educated consumer, and they're asking more intelligent questions and really listening to what we're saying about their plan selections.
that's really great to know. I'm glad that people are giving more importance to all of this and doing that. That's great.
Awesome, awesome. Yes, it's good to see. It's a more educated consumer, so it's really good to see. And I will say in the South Asian community, you see it more so than a lot of other communities. They're really bought into the fact that we need coverage, and if something happens, we want to make sure that we have access to the best, not just a doctor, but to the
Right.
best that my money can buy.
Mhm.
Absolutely. And before I know Sandeep is ready to ask you the next question, but I also want to tell people that do follow Simple Choice Insurance Brokerage on Facebook and Instagram. We are in conversation with the CEO of the company. It can get better than this. This is the time. And if you have any questions, comment below and ask that question. So, but now over to Sandeep. I know you have the next question for Mr. Laquinton.
Yeah, once again, welcome everybody, and good to have you on again, Mr. Laquentin.
Thank you,
Uh,
sir. Thank you.
so yeah, my question is, do you have any advice for people who still have not signed up or that are trying to do it themselves?
Hurry up! Don't do it yourself.
Wake up!
Yeah.
This, and I mentioned this in our last broadcast. I literally,
Mm.
I work with. I'm pretty fortunate because I have a very broad base. Um, I have people that barely getting by, and I have people that are multimillionaires that are my clients. I have people that have no education. Well, there's no such thing as no education. Life experience brings education, but I have people with PhDs, doctors, lawyers that are clients, and the thing about it is that when you do it yourself, you're the the above average consumer does not speak insurance, and they just buy on price. A lot of times they buy on price, and sometimes when I say buy on price, you'd be surprised, some people will just pay more thinking it's the better plan, but in all actuality it's not. Just keep in mind, you know it's better if you speak with a professional. We go through all kind of tests and certifications from the carrier, but these are a few things I want to actually keep in mind. Okay, keep in mind the copay for going to a physician, your primary care and specialist. Okay, you want to make sure that they exist and you're able to do those without meeting the deductible. So a copay is an indicator that you're able to make that payment without making the meeting the deductible. The other thing that you need to be aware of if you're going to do it on your own is the difference between the deductible and a maximum out of pocket. A deductible represents the amount that you must pay before the plan pays anything. Okay. The maximum out of pocket represents the maximum you will pay for that plan. So if you go to the hospital and you have a max out of pocket of $2,500 and your bill is $1 million, the most you will pay would be to 2,500. So the question that I got asked several times yesterday, and I often get asked, is do not copays and premium, is that considered to be a part of the deductible? No. Once you meet your max out of pocket, you still have to pay the premium and you still have to pay your copays. The co-insurance piece is what goes away. And co-insurance is often represented by a percentage sign, okay? And the co-insurance goes into play when you have a difference between your deductible and maximum out of pocket. I know this is technical, but we have a checklist we go through, a 10-item checklist we go through to make sure we are covering those things. And a lot of times, clients are not taking into consideration. The last nugget I'll give you, not it's not, this is not everything, but just key things. The last nugget is you want to make sure that your blood work and medication have copays. Not necessarily because when you don't have a copay associated with them, that means you have to make that meet the deductible first. So make sure that your copays, you have a copay for your blood work and you have a copay for your medication so that you can get access to those without having to meet a large deductible. That would be my advice to someone that's still trying to do it themselves. I really encourage you, and I'll be working all weekend. I'm only going to take off tomorrow, but I'll be working all weekend. Is to talk to someone because when we get toward that last get towards the end, systems start to slow down. There start to be issues every single year, and seem like inevitably every single year we're up to midnight trying to get that last one in for people waiting to the last meeting. Get yourself a peace of mind. Get it done by the, if you can, by the 15th, so your plan is ready to go by December 1. You have it in, and you're comfortable. You're going through you're taking care of business.
Awesome, awesome. That's great advice. That's good.
And I mean, I was listening to that and I was thinking, that I need to actually get with and get that time and talk to Mr. Laquentin, because I need some advice on my next year's healthcare plans. Even though, I've been very good with always having insurance and keeping up with it, but I need to check whether my plan is good. What else can I, what else is out there, like he's been saying. So yes, I am looking
Now,
forward to talk to you about that.
just one more quick advice thing. I'm sorry I forgot to mention. Whether you're doing it or someone else is doing it, on the left, make sure, and it's easy to do in our system. In our systems, I'm able to go in and put in the doctor's name and the hospital's name, and it eliminates all plans that do not take that. So, like for example, yesterday I was working with a business owner in Sugarland, and he had his doctor. I want this doctor. Okay, we put this doctor in, and the plan that that doctor took was $200 more than the other plan. I
Oh
asked him a
wow.
question: is that doctor worth $2,400 a year? He said, I don't think so. But you want to, if you're doing it yourself or you work with someone, make sure they're putting in your doctors and in the hospitals you want to go to, so you don't get any surprises, to make sure those things are covered. And if you have these any type of specialty medications, our systems allow us to put in those medications to give you an idea of what those costs are going to be. So when you first get everything done, make sure you know what the cost to go to the doctor, your primary, your PCP, your specialist, and go ahead. And this is a big one that I always forget to mention, but make sure you go ahead and find what's called an urgent care
Mhm.
that's within your plan and know where it is, right?
Yes.
And how much it costs to go there. Because there's a big difference between an urgent care and emergency care. Urgent care normally have a flat rate copayment of about anywhere from free to 50, $60. The emergency room buildings you see, they normally start out around $1,600 for your one
Wow.
visit. So I don't know about you, but 1,600 or 50 or free. I think I kind of like that 50 or free a little bit more than 1,600.
Absolutely.
Yeah, of course, of course. Dang. So yeah, thank you again. Thank you again for that advice. Of course, there's more questions we got. I'm definitely gonna ask you. Are there plans that seem to work better for people who live in Sugar Land, Missouri City, or Richmond area?
Yes, and I actually talked to my lawyer before I came online. He told me
Mm,
do not mention their names. So when we talked about that question, I have to kind of this is the what you do. You look around. What hospitals do you see? Okay. What clinics do you see? What what urgent care facilities you see? What doctors you see? Write those things down and make sure the plan includes those.
mm,
That's because Sugar Land is in the Missouri City, Richmond area. It's kind of out there a little bit, you know. And the thing that bothers me the most is if there's some of the plans where your closest hospital that I consider to be somewhere I would take a family member could be all the way to the medical center.
Mhm.
yeah.
And you don't want to be in Richmond or in Missouri City or in Sugar Land and have to be taken to St. Luke's or St. Joseph's or all the way down to the medical center. You want to make sure, because particularly something like a stroke, every minute counts. You only have so much time before you begin to really lose serious functionality that can't be replaced. So just look around you. And when you look around you, there are going to be certain plans. Well, one plan in particular, there'll be certain plans in the area that will work better than most. And I will encourage you to have plans that will include those particular carrier. I almost said the carrier name.
Mhm.
The carrier's name. I'm struggling with that. But just make sure that you are in a plan that represents hospitals or doctors that you can get to quickly, that you're going to feel comfortable with, and that can relate to you. Even I have a lot of clients where English is a second language, so make sure they take that into consideration. I was working with your mom, and we was looking for a dentist, and I picked all the dentists that speak Hindu and Urdu and Shinbati, and she said, "I don't need that."
I speak English.
I say, "I know. I'm just trying to be smart." And she said, "Nah, nah, nah." But so some people that is something they want. They want that language there. So
Yes,
if you if you have those preferences, please just make sure that you in those areas you consider the fact that you're far out. So you want to make sure you're selecting plans that have a hospital or a doctor's office that you want to go to that's in that Sugarland, Richmond, Missouri City. It's kind of the southwest
yes,
area. It's the same thing with Katy.
sure. And I guess with any part of town, because like Sandeep lives in the Cyprus area, right? Is that the
Yeah.
Cyprus or the Tombol? Sorry,
I'm close to both. I'm
both
more on
somewhere in between.
So
it's
you,
Yeah.
Houston, but I would say spring.
Spring.
It's pretty
Oh,
much
okay.
spring.
so you
Yeah.
north of 249, in between 249 and
I'm
45.
249 is like I can literally almost see it from the house. Yeah.
Right. And see, like even that area, because
Yeah.
I used to work for HEB years ago, so I know all the areas there.
Yeah. Yeah.
So he'd be looking for somewhere
Mm-hmm.
Really.
like the Methodist, because you have a
Yeah. Yeah.
Methodist
Yeah.
right there at the
We have
corner
a
of
our
249.
Methodist
Yeah.
and
So you got some
1960. Yeah.
yeah. So you have some
Yeah.
very good facilities in that area. So you want to make
Yep.
sure you would have a plan that can get you quick access. Not just that,
Mm,
when you have a situation, being
mm,
close to home where your family can get to you easily is something to consider as well. And if you're far
yeah.
Sure.
away, that makes it even more challenging for your family.
Definitely.
Absolutely. Yeah. So I need to do my homework before I sit down with you about the PCP, the closest hospital. And I was about to take the name of the insurance again, the company again, but I don't want to do it. Not that they're going to say do anything. But I'm not going to say.
They probably don't care, but because I represent many different carriers,
Yeah,
I really try not to say publicly some of the things that's just egregious. I try to
sure.
keep those to personal conversations. We want to be respectful
Hmm.
because we
Hmm.
have people in all the plans. We do. We have
Yes.
people in all the plans.
Absolutely. So that brings me to one of my most favorite questions today, actually, because one thing we know is, all the important points that Mr. Laquentin has been sharing. Other than that, one important thing you need to know is he is there for you. So you have access to him. You can call him, you can text him, you can email him, you can visit the website. I've pinned the comment below so that you know exactly what Facebook page and website and phone number. But he has been able to help people, who connected to him through Namaste Radio, and we are so happy about that. So please share something about the listener that you've helped, and how.
Well, actually, is two that one of the things I'm not good at is I'm not good at not caring. So I actually get attached to my clients. I actually have team members. Their sole job is to reach out and say hello, see how people are doing, just to check on them, because it's important to me. Two scenarios from the area. One of them is a listener to Namaste, and one of them is not, but the person that listens referred me to them. One of them is who I didn't know listened to Namaste Radio, but was already a client. I met with him on this past Saturday, and he has a 17-year-old son who was being, the strong guy, and he kept complaining about his side hurt. And long story short, he didn't go, got very bad, took him to the hospital. So and I went through the same experience myself. So his appendix burst.
Oh.
His
I've
appendix
had that.
burst. And I kid you not, I wish I had a copy of the bill to share with you. His bill was $121,000.
Oh my
The
God.
surgery was
Wow.
only supposed to take a small amount of time. I don't know. I can't remember if he said an hour or 45 minutes or whatever. I don't remember. But it
Wow.
ended up taking 6 hours.
Mm.
Wow.
His bill was $121,000. His portion of the bill was 2,400.
Oh my God. Wow.
And
Wow.
he's actually from Lebanon, and he was referred to me by a listener of Namaste Radio that I didn't know. But think about that. His bill was $121,000. His obligation was 2,400. Now, how much you think he had to pay when he took his son? His son went to Texas Children, which is one of the things I like about there's plans specifically. If you have children, my daughter is on the plan. If you have children, there's a plan that I absolutely tell you. I had a situation this summer. No parent wants to deal with the fact that they're rushing across town trying to get their kid to the emergency room. I had to go through that this summer. Got her to the emergency room, had a week stay, and you know what? I felt I was put at ease because all I did was show my card. They didn't ask me for anything. Do I have a deductible? My deductible on my plan is $4,000 because I have a
Oh.
high deductible plan. It's $4,000. They did not ask me for a cent.
Oh wow.
I gave them my card. My daughter was given a room, taken care of immediately. She had over a week stay in the hospital, and that was in August. I'm just now starting to get the bill for my deductible. This gentleman, it just happened last month with his son.
Mhm.
He said the best part about it is that things have been kind of tough, and I was short, tight. The resources was tight, but the fact is, all I had to do was show them my card. So I want people to understand that about the deductibles the maximum out of pocket. If you have an emergency situation, they're not going to make you pay that before they see your child, before they see you. They're going to take you in, and then even if there's a deductible or a max out of pocket, I mean, either way, they're going to work with you to get those resources paid because for one, they know the bill is going to be a lot higher. I'd rather get the 21,000 minus 2,400
Absolutely.
than deal with you on the 2,400. But just having something in place gets you in the door and allows you or your child to stay at that particular place because most people think if something negative happens and they can go to any emergency room, they're required to stabilize you. They're not required for you to stay there. So if you don't have health insurance and they take you to the emergency room or wherever you are, they're going to stabilize you and transfer you to the county.
Yeah, yeah. No, it's
They-
very important to have health insurance. I totally agree. It's crazy to hear these kind of stories, it's and just imagine if he didn't have health insurance, like.
yeah, I'll be on the street with a sign saying, please.
Yeah.
My
Tough
daughter was,
times,
yeah,
help needed.
please, with a
Hmm.
cup. I have a cup. Will you please help?
Help me.
Daughter,
Yeah. Yeah.
yeah. It's my intention. I'll never have a, a GoFundMe or anything like that.
Hmm.
It's important. It's important to get those things in place. I feel pride in it.
Hmm.
Absolutely. And again,
Definitely.
that's why thanks to you for, you have that knowledge. You're helping people out there to get that right information, right plan. So that's really great. Thank you.
My pleasure. My pleasure.
Hmm.
Is there anything else you would like to share before we talk about our giveaway today?
Yeah. Well, first of all, I want to say thank you. Thank you to Namaste Radio and your kindness and the things you shared. Thank you to your father. I mean, he's always been a good guy. He's referred me to so many people, and to be just the fact that I have the privilege to serve him and your mom is a pleasure. So I want to say thank you to him and to you. But I just asked one last thing that I would say. I would ask people to go a little deeper. It really isn't about the health insurance. It's really about your quality of life.
Mhm.
Because because I work with Medicare and ACA, we have so many retirees that are dealing with health issues that if they would have had insurance or if they would have been a little bit more conscientious when they were younger, they would be able to enjoy their retirement years better. Keep in mind, if you not going to the doctor for the proper checkups, and I see this in the African American, Latina, the South Asian market, we don't have the best traditional food to eat, right?
Mhm.
So we have these conditions that get worse and worse and worse, more so in men. So when it gets to a point of pain or discomfort, it's either it's too late or our condition is going to be much worse than it needs to be. So I want to issue a challenge to everyone that can hear the sound of my voice, particularly for men. We have something called visceral fat. Okay, that pertains to the excess we have around our midsection. For men, that's very, very bad. It affects so many of your organs. We gotta, as a community, we gotta start having these conversations. I was talking to a young lady she was crying on Monday because she can't get her dad to change his diet, and his kidneys are going bad. His cholesterol is through the roof, and he's a diabetic. But we are literally eating ourselves to death. So my message is far beyond that. Health insurance is only a tool that enables you to know what's going on in your body. The real issue is, as a community, we have to have real conversations around health and wellness, mentally, spiritually, physically, and emotionally. And having those conversations, health insurance for me is just the beginning. So, all you young ladies out there, all you daughters, mothers, and grandmas, you got to get on our case to start really taking these things seriously when it comes to our health.
Absolutely.
Mm.
Great advice. Thank you so much.
Yeah. Definitely,
Sandeep,
definitely, guys.
Sandeep works out every day. I see that.
Yeah, yeah, you have to. There's it's for me, I gain weight very fast, and I feel very jealous of people that can eat whatever they want and they don't gain a pound. So for me, I have to do double workouts, right? So to keep that up. So, but not only for for just being fit. I mean, you could be fit just to keep yourself balanced, and
Hmm.
working out is also helps you give you a lot of energy, and it makes you want to do more things throughout the day rather than just
Yeah.
calling things off, right? So,
Someday I'm gonna do some talks on what's inside my journal, and
mm,
it's very deep in the sense that we go to the university, right? And all during our children's lives, we're preparing them to get the best education,
Mhm.
knowledge wise.
Yeah.
But what I see this happening is your mental ability deteriorates as your
mm,
physical wellness goes down. So if you're having to take medications, we consider to not take the best care of it. It affects your ability to think, focus, retain, have a high energy level. And with our kids and adults, it happens a lot with our seniors. we're seeing record numbers of people that are going to psychiatrists, going to therapy. I know in some communities, particularly one of the ones I represent, that's like taboo.
Hmm.
But the reality is that our physical bodies are affecting directly and indirectly our mental capacity to perform at a high levels. And it's an issue. And I even see that when I go to some of the physicians. I took my daughter to the doctor, and she was giving my daughter all these advice. And after we left, my daughter said she worse than so we have to challenge our physicians to represent what they're telling us. Because if you as a physician, if you're not taking care of yourself, but you're giving advice to your patient, how you think we're gonna look at that?
Absolutely. Yeah. No, not at all.
You say take your own
It's
advice.
uh, now before Sandeep, shares some information about that giveaway. Tell, uh, please, can you share the deadlines again for enrollment for the ACA and Medicare ones?
Okay, so Medicare is almost over. Medicare ends December 7th, and that is,
Okay.
and I'm telling you guys, it happens every year. If someone is putting in an application at 11:59 or 11:55, that's not gonna work. So December the 7th. Now, and I will share with you if for some reason you make a selection and you don't like your plan, and this is only for Medicare Advantage, and you don't like your plan, you have an opportunity January 1 to January to no, March 31st to change one
Mm,
time. And
okay.
it's called like to like, which means if you have a Medicare Advantage plan, you can go to another Medicare Advantage plan. So if for some reason, it doesn't work out for you, understand you can give us a call and we can help you through that process. Now, there's two deadlines I like to mention with ACA. One is December 15th and one is January 15th. Okay. The December 15th represents if you want your plan to be effective for January 1,
Mhm.
you need to have not just not just your plan selected, but it must be selected and paid for by December 15th so they can for your plan to be effective 1/1/2022. And 11:59 on January 14th is the deadline for ACA, and you're done. Now you do have things called special enrollment periods that if you were to change an immigration status, lose coverage on your job, relocate, unfortunately going through a situation of abuse, have a child, get divorced, there's all kind of special situations throughout the year if you experience that we're able to do a new enrollment for you. But for the most part, just keep in mind, just think December 15th.
Mhm.
And we'll deal with anything after December 15th, but think December 15th so you can have a plan in order for January 1. December 7th is the last day to cut off for your Medicare Advantage plan. So we'll be working 7 days a week. Appointments can book until up to midnight. After that, I can't be responsible for the outcome of your application
Hmm.
because I'll be sleepy at that point.
Absolutely. No, thank you for sharing that. Thank you.
You're quite welcome.
So,
You're quite welcome.
Sandeep, you want to go
So,
ahead and share the video?
yeah, let's talk more about, let's now see this giveaway. What's this fun giveaway all about? And then after that, Mr. Jenkins is going to tell us when you have till you can register and also when the winner will be announced.
Hey Namaste Radio listeners, Simple Choice Insurance Brokerage and Namaste Radio are sponsoring a family fun weekend end. Get a chance to win 7 free entries to the Houston Zoo on November 27th and 2 Houston Texans game tickets on November 28th. You heard it right. A Simple Choice and Namaste Radio family fun weekend. To register, visit www.simplechoiceib.com/namaste and like Simple Choice Insurance Brokerage and Namaste Radio on Facebook and Instagram. Don't miss your chance on this amazing family fun weekend giveaway. Again, to register, visit www.simplechoiceib.com/namaste and like Simple Choice Insurance Brokerage and Namaste Radio on Facebook and Instagram.
Okay,
That's
Wow.
right. That's
that's
right.
pretty exciting, fun stuff. The kind of the reason we chose this weekend because traditionally in America this is a family weekend. Everybody's celebrating Thanksgiving, we know the traditional meaning behind it, for Americans, but for me, it's really just a moment in time that we're taking out to give thanks for all the blessings that we have, regardless of your culture, background, or experience. I just see it as a time to give thanks. So, being that my family and friends are so far away, I was trying to do things to support people that are here that may be in the same situation. I know many people, a lot of their family is not in America or they're not in the same state. So
Mhm.
we try to create a situation that if they're here visiting or just, to get the family together. So I'm biased. I love the zoo. Man, I love
Mm.
looking at the animals, but sometimes it makes me sad because you can see that their spirit has been taken out because they're in captivity. But I just love the
Oh,
the zoo and the experience of the zoo. So what we did is that we have a membership at the zoo, and we take people. So the bottom line is on Saturday you will meet me at the zoo at 10 a.m. The cutoff
nice.
for the cutoff for the registration is midnight midnight on Friday. So we'll reach out to you 10 a.m. 10 a.m. at you'll have the ability, and we go in. I'm not going to stay with you the whole time, but just you and your family members can go in. I'll get you in, and we'll get you some refreshments and laugh and talk for about 5 minutes, and you have access to do whatever you want inside the zoo. The football game, I know it's not cricket. I know it's not cricket, and the Texans are not doing as well as we would like. So most people go to just to watch the other team play.
That's
But
the case right now. Yeah.
the cutoff is still midnight on Friday, and the winners, it's the tickets for two. So whoever gets it, you get both tickets to take you and a person you care about. I'll meet you there as well. I will send you the tickets. I'll transfer you the tickets to your cell phone. They're digital tickets, and you just go in and you scan the tickets there. And I'll meet you there, and I'll be your host. I'll buy your drinks. I'll buy your food, whatever it is that we enjoy the game on Sunday. Well,
Wonderful.
we enjoy something. I don't know how much we gonna enjoy because I don't know. They're playing the Jets, so it might be a better opportunity. But it's a great atmosphere, guys. It is for particularly people who
Mm.
haven't gone. It's a good atmosphere, and that's kind of how that works.
Wonderful, and we are excited
Amazing.
to partner with you on this. Thank you so much for sponsoring this. So, guys, you have time till Friday midnight, 11:59 to be precise. So just log on to www.simplechoiceib.com/namaste. It is on the screen right now. Simplechoiceib.com/namaste, and you'll be able to register there. And of course, Mr. Laquentin is going to reach out to you and let you know if you won tickets to the zoo or the Texans game on Sunday. So thank you so much.
But I do want to say that the seven tickets they go to all one family.
Oh,
It
wow.
goes. They're
Mm.
not broken up over a bunch of different people. They go to all one family.
So
One family.
anybody can register and take 7 people.
Hmm.
That's awesome. So do Sandeep and I qualify to register, Mr. Laquentin?
Well, I have season tickets, so I can take you guys anytime you want to go.
Yay! We should have a
Sure.
It doesn't.
Namaste
It
game.
doesn't matter. Whenever
Yes.
you want to go, just say, "Hey, let's go."
Hmm.
We'll go. We need to take your mom and
So,
dad.
mm.
Yeah. My mom and dad both love the game and the zoo.
He, we actually going. He and I are going on the first Sunday in December. He's going to reach out to
Wonderful.
your husband to invite him as well.
Wonderful. And Sandeep, you should go with them too.
Absolutely,
Yeah, sure. Why not? Why
Boys
absolutely.
not?
game out, whatever.
Hmm.
Your mom, she said that's the thing is, she said yes. Me and Vanessa can go shopping.
Oh,
Hmm.
okay. Yeah, that's a great idea. But no,
Women think so
thank
far
you
ahead.
so much. Thank you. Uh, that's the giveaway, guys. Again, simplechoiceib.com/namaste. And we spoke about a lot of important things, the deadlines. You have Medicare till December 7th, the ACA till 15th of December. So any questions, anything, reach out to Mr. Laquentin Jenkins, the CEO of Simple Choice Insurance Brokerage. His number is out there and it's on the screen: 832 626 7791. And If you just want to go visit the website first, it's simplechoiceib.com/namaste for information and for the giveaway. So
And
don't wait, do that.
we have 24/7. I hate for people to call in and get a voicemail.
True.
It may happen. It rarely will happen in organizations. So we actually have staff in the service. So as you can imagine, I may be talking with a client, and so I want people to be able to talk to a person. So we have a service. Even if you call at midnight, 1 o'clock, 2 o'clock, there should be someone answering the phone for you to to take your information, get you to talk. I like to keep the human in what we are doing and keep the machines out as much as possible. So we want you to be able
Absolutely.
to talk to a physical person.
Yep. Yep.
Absolutely. Thank you so much. And again, follow Simple Choice Insurance Brokerage on Facebook and Instagram. Thank you so much, Mr. Laquentin, for joining us today. Yes, namaste from our
Namaste.
side. Great information, and we will see you soon. But happy Thanksgiving to you and your family from all of us.
Thank you. I can't
Yes,
tell you
sir.
since I met you guys how many times I've done this. I'm doing it to everybody. They're like, what does that mean?
Good karma is going to
Good
flow.
Yes.
karma's gonna flow. I love it. I love it.
All right, we'll sign off now. And thank you so much. Thank you. Sandeep, any last words you want to say before I see you on Saturday?
Just no, just enjoy, have a lot of food, be safe, and if you're looking to go places, I got plenty of places I'm playing this week, so just get in touch with me. But otherwise, just be safe, everybody, and if you're having those drinks down, there's always a thing called Uber and Lyft. Do not drive. So that's
Absolutely.
all.
We know you're talking
Yeah.
about Coca-Cola, right?
Yeah, exactly. Yeah.
Sprite, Dr.
I
Yeah,
just,
Pepper.
I
exactly.
drink only water. That's it.
Mm.
Everything
They,
has water in it.
exactly.
Exactly. Everything is one.
All right.
Well,
Thank you
thank you,
so
sir.
much. Thank you.
Mm.
Happy
All right, you
Thanksgiving,
guys have a
guys.
happy Thanksgiving, everyone.
Thanksgiving.
God bless you.
Happy
Take
Thanksgiving.
care.